Okay. Welcome everybody. Thank you for joining me today for Rural Health Resources. My name is Sarah Levin-Lederer, and I'm an Outreach and Education Coordinator for the network of the National Library of Medicine, Region 7. A few informational things before we get into the presentation itself. Everyone has been muted to limit background noise, but we do welcome your questions and comments at any time. Please use the Q&A function to share your questions. And if there are some comments, please, we will have some questions brainstorming at one point in the chat. And then also chat is great if you want to share some information with your fellow attendees. But questions, please, Q&A. My colleague Lauren Whittick will be providing production assistance today, and she will be keeping an eye on your posts. She will also be reading out some things, including the Q&A as they come in, and save the questions for set times during the presentation. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. Closed captions are available. Locate and click the CC button at the bottom of your screen to start the captions for yourself. We are recording today's presentation and we'll email the link to everyone who registered. And then finally, please be sure to fill out the evaluation link we share with you at the end of the session. Your feedback really matters and helps us improve future trainings. So please take a moment to complete it. And also filling out the evaluation at the end will be how you access CEs for this session. So with that, I briefly wanted to introduce the network of the National Library of Medicine. I'm sure that many of you have taken classes with us before, so welcome back. And if you haven't, welcome. As the name suggests, the NNLM, the network of the National Library of Medicine, is part of the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. So as I mentioned, I'm with Region 7, which is New England and New York, but wherever you are joining us from today, there is a region that covers you. I do want to mention two rural specific resources that we have. First is the NNLM Reading Club Rural Health Collection. The Reading Club serves to help libraries with health literacy outreach and engagement through reading. It's similar to a book club with book selections and guides related to health topics. On the NNLM Reading Club page, you are able to see recommended books by health topic, download discussion guides, and promotional materials. And the link should be in the chat. We also have a rural health resource guide on our website, which has been, the resources have been collected through other rural related classes that NNLM has put out in the past. And the recordings of those classes can actually also be found on that guide. So, for our objectives today, we're going to describe the current demographic trends in rural America, explore data sets and visualizations from rural health resources, and locate information on health conditions, demographic groups, structural challenges. And it's going to be divided into two sections. We're going to do an overview of some demographic trends and information, and then we will switch to a live demo of resources where you can help resources you can use to locate information on things like health conditions, demographic changes, and structural challenges. So before I switch to my next slide and we get into that overview of demographic changes, I would like you to think to yourself about what you think of when you hear the term rural. What does the landscape look like? What do the people look like? What is the industry like? And I want you to keep that in mind because rural looks very different across the entire country. Like I said, I live in New England, so what I may be picturing may be very different from what rural looks like where you are. And so we are going to be talking about broad national trends, but I hope throughout the presentation you're thinking about rural where you are and putting the information into a local context. So today's class, of course, we've said rural a couple of times, is about rural health. And so depending on the definition, about 15 to 20% of people in the United States live in rural areas. There are many different reasons why people live in rural communities: lower cost of living and a slower pace of life. Rural areas are less crowded and can offer more privacy. You may live in a rural area so that you can be near your family or friends, but there are challenges to living in rural communities when it comes to taking care of your health. Compared to folks who live in urban areas, folks in rural communities are not able to get to a hospital quickly in an emergency, need to travel long distances to get routine checkups and screenings, have less access to dentists and certain specialists, might not and certain specialists might not be available at all. Folks in rural communities have higher rates of certain types of cancer as well from exposure to chemicals used in farming. And so that is sort of a broad pros cons um, of living in rural areas. And so in the chat, and Lauren will help read out some of the things that you think of in your experience, in your life, and in your work. What impacts health in rural communities?
We have a few answers coming in.
Okay.
Driving distance, lack of transportation, access to internet, shortage of healthcare providers. Mass transit is not easy to find. 2 hours on a winding road can get to the nearest big city. Let's see here. Healthy food deserts, transportation barriers and provider shortages, another distance and transportation to doctors and healthcare, access to specialty care, another transport, even if they have a car, roads are not always well maintained. Distrust of medical professionals and institutions at times, lack of providers, lack of specialists, lack of funding. And it goes on and on. Lack of medical professionals, access to care for mammograms, lack of childcare, reliable transportation, health literacy, sometimes low social connectedness, poverty, illiteracy, cost to leave their occupation, and nighttime driving more risky are the comments that have come in.
Yeah. So I'm gonna, there we go. So I think the list that you all came up with, I think, are the ones that we have also seen and that also come up often in studies of what impacts health in rural communities specifically. Transportation, lots and lots of folks saying transportation, lack of broadband and connectedness to the internet, lack of insurance, lack of providers, especially those specialty providers, environmental health hazards, and then also occupational health hazards. So yeah, what you are seeing in your communities, what you are experiencing is what is being seen in those larger studies as well. So our first point is to describe the current demographic trends in rural America. And so the first thing we're going to do is actually define what rural means. So the federal definition of rural, any area that isn't urban is rural. Um, and that is a very broad definition, and it's one of those, well, I'll know it when I see it. There are definitions of urban, and so it's definition by exclusion. And I'm going to, and before I get into some of those nitty-gritties, this is this is the big takeaway. I don't necessarily want you to come away from this presentation being able to say, these are the keys to what is urban, and therefore anything that is not that is rural. Because the definitions of urban are also incredibly complex and also not fully agreed upon across the board. So what I would like folks to come away with is that there are different definitions of urban and rural. The two that you may come across most often are from the Office of Management and Budget and from the Census Bureau. And they basically give a range. So about 15 to 20% of Americans are considered rural based on the definitions. The other thing to take away from this is especially if you are applying for funding or you are going for programming, to be aware of what definition they're using, because that may change whether or not, excuse me, whether or not your community is eligible for that program. So Office of Management and Budget, Census Bureau, and definitions are not clear cut, may include or exclude areas that don't always make sense. For example, the census definition is done at the census block group level and doesn't follow city or county boundaries. And the OMB definition is done at the county level. So some areas that people might consider rural, if you live there, are in urban counties and not counted. Um, so that's sort of the big takeaway from this. The nitty-gritty of the specific definitions are out there, but I did not want to confuse the issue by uh, having you think that you needed to memorize them for this. So, so um, we will be talking about several different resources that you can use to learn about some economic trends, to learn more about what's going on at more local levels. But the first thing that I wanted to mention and that we will actually dig into during the live demo is the Economic Research Services from the U.S. Department of Agriculture. And the big thing right now for this part of the presentation is that annually they put out a report, Rural America at a Glance. And so this report is looking at trends in migration, economy, and industry, and is a great source for informational overview and snapshot of rural America in the past year. They have other data and reports that we will dig into during the live demo, but right now to mention this because this is the takeaways from the 2025 report. So this edition offers aggregate and county level statistical analysis of population change and indicators of economic well-being for non-metro areas, including employment, income, and poverty. And one of the things that the report mentions up front is that there's continued to see in-migration growth, so more people moving in to rural areas than out, but natural growth is still lagging. So there are still more deaths to births. So people who work in rural areas, I think one of the things that didn't necessarily come up in the health impacts when we were talking about that earlier was aging population. Rural areas have uh, outpace metro areas in aging populations. So a few of the other takeaways are non-metro areas have rebounded from the COVID-19 pandemic economy, with poverty and employment rates reaching pre-pandemic levels in 2023 and 2024. There has been recent growth in real median household income, albeit to a lesser degree than the growth experienced during the economic expansion that preceded the pandemic. income and poverty levels were not uniform across rural America. There continues to be a north-south divide and differences in industry growth and shares. So, for example, manufacturing jobs went down, but continue to be a leading employer in non-metro areas. Healthcare and social services went up in 2023, 2024, continuing upward trend. And again, a lot of the healthcare and social services are related to that aging population base. Continued positive economic indicators such as low debt to income, median income growth, and lower poverty rate. The non-metro area poverty rate was one of the lowest on record in 2024, and that's a direct quote from this report. The biggest conclusion is taken together, the indicators presented in this report suggest a balance of growth and stability in rural America. And so these are the high-level key takeaways from this report, but if this is something that is useful to you, the report breaks it down and has additional analysis as well as additional numbers, charts, graphics, things like that. So then one of the other things that was seen in the 2020 census is that rural demographics are becoming more diverse. In September 2022, the University of New Hampshire Carsey School of Public Policy released a brief entitled Growing Racial Diversity in Rural America Results from the 2020 Census. And according to the brief, rural America is becoming more diverse. And so this quote from the report really puts things in perspective. Nearly 1/3 of all rural children, 32.5%, come from racial or ethnic minority populations compared to 28.1% in 2010. In contrast, 21.6% of the adult non-metropolitan population are members of a racial or ethnic minority. The growing child diversity is the result of two diverging trends. Over the past decade, the rural minority child population has grown by 7.4%, while the non-Hispanic white population has declined by 12.7%. The contrasting patterns are in part because a larger share of the white population has aged beyond childbearing years. And so again, this is another in-migration growth versus natural growth, the births versus deaths. Another trend worth noting is the intersection of poverty and race slash ethnicity. This chart is an example of the charts that are available from the Economic Research Service and shows higher rates of poverty in rural areas and that the gap for people of color is larger in rural areas. So that gap that exists nationally is wider in the rural areas than in the metro/urban areas. So, another chart for folks. So this actually comes from the 2020 edition of Rural America at a Glance, and this goes back to some of those things that we were talking about earlier about the health issues faced in rural areas and actually put some numbers to the vulnerability and disparity between uh, non-metro and metro areas. So underlying health problems, uh, old, older adult population, lacking health insurance, distance to hospital with intensive care unit, we can see that all of those numbers are higher for the non-metro populations. And as we discussed earlier, access to healthcare is an issue that has come up on multiple places in this presentation. And because it was something that came up in the chat a lot, I'm sure in people's lives as well. So the question, why are hospitals closing? According to an American Hospital Association report from September 2022, low reimbursement rates, staffing shortages, low patient volumes, regulatory barriers, and expenses for labor, drugs, supplies, and equipment. And so the Center for Medicare and Medicaid Services is attempting to address this trend with the new designation of rural emergency hospital, which actually became effective about 3 years ago, January 2023. And the designation seeks to keep emergency departments open in rural counties, but requires hospitals to stop inpatient services. And so from a two-page report on the REH model that came out about a year and a half ago, 32 hospitals in 14 states have converted. The relatively rapid growth of the REH model has helped reduce the national rate of rural hospital closures from an average of 14 closures per year before the COVID-19 pandemic to 3 closures so far in 2024. So not a ton of hospitals have converted, but they are seeing that it is helping in the areas that maybe that was the only way to keep the hospital open at all. So I'm going to go fast action, mention a couple of resources because we actually are going to get into some of these more in the live demo. So the Rural Health Information Hub, we've been talking about demographic trends in rural America, race, ethnicity, poverty, and hospital closures. And so you may need this information at a more local level for program planning or grant writing. And so Rural Information Hub, USDA Economic Research Services, are both places where you can find this information. And so RIH Hub bills itself as your first stop for rural health information and is a great source for exploring the topics from the chat earlier. So everything that we mentioned, things like transportation, broadband, lack of providers, there's good information there. So our next topic to touch on is information on health conditions, demographic groups, and structural challenges. And so the first resource I want to mention, and again, this is going to be in the live demo more in depth, is Medline Plus for patients and providers. This is a resource for health information in plain language. So folks who don't necessarily have a health background, but are interested in learning more about what they may have heard on the news from their doctor, from their family or friends. And then the CDC Rural Health page is also another one that allows folks to look up information about rural health, about topics that specifically affect rural health policy briefs, and then also success stories. So like if you are looking to do a program, the success stories might be a place to look to see what's already been done well. And then, of course, more links out to rural resources. So we have made it through the first half, and we are about to launch into our live demo. So as I sort of switch over to the live demo, are there questions about the first, what we've been talking about so far?
So far, no questions. Someone did put a helpful link in the chat for a resource for aging population 65 plus by state. So I just wanted to draw attention to that, but no questions so
Awesome.
far.
Okay. So we are, like I said, switching from the sort of informational to the live demo side of things. And we're going to start with the U.S. Department of Agriculture's Economic Research Services. And so this, like I said, is where the Rural America at a Glance report comes out every November. And it looks at some of the biggest trends in rural America. There is data, uh, analysis, reports. A lot of it is about farm industry, but there is some demographic and other information that may be more useful to sort of the health side of things as well. I do want to point out Amber Waves is their newsletter. So if you are interested in getting some of that analysis and reports and blog posts to your inbox, signing up for that will do that for you. So I'm just going to slowly scroll down so you can get an idea of what's available. So some of the most recent reports that have been put out, charts of note, and we're going to go back to those in a minute. Food Access Research Atlas. This is mapping, and so you can search through some mapping. Amber Waves is their newsletter. Ag and food statistics, so charts on production and also things like the U.S. Department of Agriculture oversees food assistance programs as well. So there's information on that. Food Environment Atlas, and then data visualization, and then some of the data components, and then again, some of the most recent things that they have put out. So I want to come back first to the state fact sheets. These are more, um, it does the overview, population, income, poverty, food security, education, things like that, as well as the farming infrastructure in those states. And so I'm going to pick on Wisconsin. And so you can get an idea of what the fact sheet looks like. It's got your population overview, um, rural, urban total for various years, um, income, and then also you can see, they have a link to what is rural. They are using the Office of Budget and Management definition for all of these statistics. Um, Links for things like county level poverty data, rural poverty and well-being topics, um, and then some more of the census information uh, broken out specifically in rural versus urban, different kinds of farming, since it is the U.S. Department of Agriculture, finance. And so you kind of get an idea of what's in the fact sheet by state. And so if we wanted, I'm going to jump out of that though, because the thing that I really want is to show the charts of note. Um, so the charts of note have just a long list of all of the research and data that they are pulling together and putting out. And so that's a lot. US production of 7 popular pie ingredients, near $7 billion. Um, Interesting, but not necessarily what we are uh, talking about today. So if we come back up, we have the filter by topic, and we see that there's the animal products, crops, farm bills, farm economy, farm practice and management, food and nutrition. And I'm going to scroll. And so at the bottom here is the rural economy and population. So this is a lot of what we were talking about in that earlier um, piece. And so you can see that you get things like rural population reaches 4.2 million in 2024, educational attainment, county population growth. So these are, again, the demographics and uh, population-based information. And so I want to come down here to the home health care establishments for serving rural areas increased about 36% from 2010 to 2023. And so when we click into that, we can see the chart, and it's talking about what had been mentioned earlier, that the aging population means that non-metro elder care establishments have been growing. And so we have a chart with some notes, and then we have the discussion, explanation of what's going on. And then we also have our links for more information. And so it is filed under rural economy and population. So that would link would take us back to those charts that we were looking at. It also gives you the data source that they were pulling from, and then the analysis. So if you want more information about this, these are the reports that would give you more of that. So again, the Rural America at a Glance, the 2024 edition did talk a lot about the uh, age divide and the aging population, and then linkages between rural communities, capitals, and healthcare provisions and uh, healthcare access among self-employed workers in non-metropolitan counties. And so when you click into that information, it gives you the resources you need to dig a little bit deeper if that's what you're looking for. I'm going to pop back out and then pop back out and pop back out one more time to also just very briefly touch on the data visualization. Um, so the charts of note have the full analysis, the breakdown of things, all of that. The data visualization is just the pure Tableau data, but it can give you that sort of uh, background, back end look at how the data was visualized in that case. And again, the headings are the same ones that we saw in that filter earlier: animal products, crops. And if we want to look at the population stuff, we have to scroll all the way down. Good choices. Health. But they are there as well. There we go. So then um, a few visualizations on persistent poverty and high poverty in US counties is what comes up on the Tableau. And then if we switch back over one more time, there is the ability to just explore the data, not just the nice charts, but the data itself. And again, the filters are the same as what we were seeing before. So if we scroll down to rural economy, and then we can look at, if we only want things with visualization, we can. Oop, doesn't have that. So uh, the more specific data driven side of things that you can search through that as well. So that is the overview of the USDA ERS. And before we switch to the next resource, which will be our IH Hub, any questions about ERS?
So far, no questions have come in, but if you do think of anything, please put them in the Q&A.
So then we're gonna switch over to the Rural Health Information Hub. And so this is, again, they build themselves as your first stop for rural health information. And again, RH Hub gives you the opportunity to go more local. And also explore some of these other things that we had been talking about, like broadband access and transportation and um, some of the cost of living things, some of the other social determinants of health. And so we have topics and states. And so like this is just pure list form, topic guides. So we were talking about access earlier. So rural health clinics, federally qualified health centers, and then the state guides. And since I picked on Wisconsin earlier, I'm gonna do that here. And so this gives you an idea of what kind of information is available in those state guides. And so you have sort of your index on top, chart gallery, resources, organizations, funding opportunities, news, events, models, rural health transportation program or transformation program, and then about this guide. And so we can look, you've got your overview, you've got your metro versus non-metro counties. Um, you have estimated population versus estimated in non-metro areas. They have a really nice visualization of rural healthcare facilities. And so you can see that there are 58 critical access hospitals, zero rural emergency. So that's the REH, the hospitals that closed everything but their emergency room. Um, so Wisconsin doesn't have any that have converted to that model. Rural health clinics, FQHCs, um, short term. And so you've got it all mapped out. And so if we wanted to look at, pick on Bayfield County. So, you know, got there. So we can look here in Bayfield. You've got your, uh, you've got two federally qualified health centers when you take a look at the map all the way up north there. Uh-oh. And now I can't. There we go. Um, so then you get into your charted information on some of the social determinants of health. So specifically for Wisconsin, uninsured, metro versus non, um, educational attainment. And so you can see that it's all laid out in very clear, very easy to read charts. And then you get down here. So the other thing that on the state page that I want to show you is the funding opportunities. And so this is very specifically, if you click from your state page, going to give you things that are only open to you and your state. And so you can, narrow by type, narrow by topic, but you can just get an overview of what are some of the um, funding opportunities available to rural areas in your state. So I'm going to go back out. I'm going to go. So click over to the chart gallery. So again, by topic, by state, by type. And so if we go to topic and we look at health workforce, since we were talking before about specialty care and sometimes how far you have to travel. So if we click into that, you can see that there are various charts that show the information. So, and you can also see very clearly which chart or which topics have charts that also give you that state level view. Uh, so, and then we were talking a little bit about shortages. So if we click in just to sort of get an idea of what some of this looks like. If you can just filter for non-metro, and then we can see that there's the shortages are in this darker blue color. So parts of Texas, South Dakota, North Dakota, Minnesota. And then you can also click into, so we were looking, so Wisconsin, and if I want to highlight Bayfield County again, they actually are not considered uh, having a shortage in that area for dental care. Yeah. I want to go back out real quick and highlight the Am I Rural tool. So if I put my zip code in, or the zip code for the office, um, Worcester, Massachusetts, if I run the report, it's going to tell me across all of these definitions of rural that it is not rural. Um, so not useful, but it's a good case study because we know Worcester, not rural. But if I go back out, and I've done this for Farmington, Maine, and I run their report, um, Farmington, Maine is up here in Franklin County in Maine. So there, and so then you can see that it does qualify as non-metropolitan, not located in urban area. All of Franklin County has been designated Federal Office of Rural Health Policy, rural area. And so what's useful for this is, again, if you are going for funding or for to participate in any kind of programming, and it gets confusing with, am I rural? Am I not rural? You know, it depends on what the definition is and what they're using and all of this. This breaks it down by pretty much any of the various definitions that are possible and will tell you, yes, no, yes, no. In this case, Franklin County is 100% rural. So, um, Farmington is rural pretty much across the board. It also, you know, does some of the broader program eligibility. So the CMS, you know, it very clearly says yes, it is rural. Um, and then very clearly says that there is a primary care health professional shortage in this area, dental shortage, mental health. Uh, but apparently it is not designated medically underserved. And so this allows you to get into that very specific, like, here's my community, RH Hub, run the report for me, tell me, what do I qualify for? Yes, no on the shortages, things like that. So, okay. Um, what is there anything else you'd want to see? That's again a very high level overview. I would recommend taking the time to sort of poke around RH Hub, because the charts and the Data Explorer and the maps cover a huge range of topics. When we were looking at the state report for Wisconsin, we only scrolled about partway down that page, so you can scroll further to see more of the topics. Um, and all of that stuff is visualized. A lot of it can be searched in the maps to be put in perspective, things like that. Um, any questions about RH Hub before we move on?
We do have a question about the resources in general.
Okay.
Are the visualizations and charts from these resources able to be used in presentations, etc., with proper attribution?
Yes. Um, ERS is easy because it is um, a federal resource. And so all of that is open source 100%. Again, with proper attribute. Most of the stuff from RH Hub is the same, I would say. Uh, for the, I would say that RH Hub, although it is not a federally funded, or it is through grants, but sorry, I'm going to back to the yes. If you have any questions about RH Hub specifically, they are very, all of the information to contact them is there as well. So m most of their stuff, yes. If you have any questions, please reach out to the people who created the information to verify 100%.
And we have one more question. Who gathers and analyzes this data?
So the data is mostly, oh, actually, let's click into a chart and see. Um, so people who work for uh, USDA, RAH Hub, they do have analysts on staff who are going through the data. And so I'm clicking back into the chart information because and so this is a random chart just picked on. So then you can clearly see that the source for the data is the National Center for Health Statistics. And then the work itself then is attributed to RH Hub and the folks who work for them.
And those are all the questions so far.
So one of the other things we talked about, we talked about the demographic data information. I wanted to switch over to the health information. So I did mention Medline Plus earlier in the presentation. Medline Plus is a product of the National Library of Medicine. It is health information in plain language. Um, and so Medline Plus has the ability to be searched in a couple of different ways. You have your health topics, which will pop up a list that you can go through. Um, and then also the medical encyclopedia. But there is the search bar at the top where you can search the way you would search any other website. So if we put in rural, it does have some suggestions. So if I click rural health concerns, it gives me a box up top, which will be to the health topic. So it will keep you on this page. But if you scroll down the results, you see rural health concerns, and then where that link is taking you is very clearly listed in the parentheses after the link. So in this case, National Library of Medicine means that it is staying on Medline Plus, or Rural Health Policy. That second link clearly says Rural Health Information Hub, RH Hub, RH Hub. Let's find somebody else. If it is going to a National Institute of Health page, it will have National Institute of Health in the parentheses and also the logo for the NIH. And so if we come, and you can refine by type. So health topics is going to be on Medline Plus and Medical Encyclopedia. If there was anything there, would be on be still here on Medline Plus. External links would be things like RH Hub, um, Mayo Clinic, American Heart Association, um, other trusted resources. Um, you can sort by the NIH, National Institutes of Health links, and then you can also refine by format. You want PDF or video. So if we click on the read more for the health topics page here, the health topics page on Medline Plus is designed to be a starting point. So you get a general summary with some basic information, and then a lot of links out to other resources that can help you learn more. And so you get your summary, and then any terms within the article that might be useful to know more, or are um, things that you might want to link out to. They do link out. So in this case, higher rates of certain substance use, cigarette smoking is a link, opioid, methamphetamine, high blood pressure, and the next bullet point, obesity. um, telehealth. And so then uh, you get sort of your links to other trusted resources. And when you look at these, they are all set up the same way with, sort of the basic information, prevention, related issues. And again, all of the links are clearly showing where they are linking out to. So lots of RIH Hub, some NIH, some NIH. Journal articles will link out to PubMed, and then also some Find an Expert. So that's the general overview of the page. You also have the option for related health topics. This will keep you on Medline Plus, but will take you to the topic, in this case, telehealth. I want to, vascular. So on a health disease or condition page, so if we go heart disease, you can see that there's also some demographic information, um, some additional resources, some more research, so clinical trials as well, and then also more on that right-hand navigation side for some of these articles. So you also get the medical encyclopedia, a longer list for health related health topics, the National Institute of Health, the NIH Institute that covers this particular health condition, if there's information in languages other than English. And so, two things before I leave this page. Um, Medline Plus is designed to be bilingual in English and in Spanish. So, on all pages, including from the home page, you can switch to Spanish using the button on the top right hand side, just underneath the search feature. So if I flip that over, this is what it looks like when I flip it over to Spanish. The navigation is in Spanish as well as the article itself. And so flip that back. And so to give you an idea of what a medical encyclopedia article looks like, let's see, heart disease. So the medical encyclopedia, the health topics page is designed to be a starting point. It's overviews and then links out to trusted health information. The medical encyclopedia is designed to give you more information right there on the page. And so you get more in-depth information about prevention, testing, uh, prognosis, intervention, things like that, right there on the page. Um, and then again, it continues to link to more and more information within that to help people understand related information, to understand a term that they might not otherwise know. So in this case, I clicked into the heart and vascular services, and if people are seeing that, oh, these are some of the related terms, and they want to learn more about heart failure, they can click on that and it'll take them to the medical encyclopedia page for that topic. And so then you see that you get images, you get causes, symptoms, tests, treatments, outlook and prognosis, and so on and so forth on that. So we are about 5 minutes from the end of our time together. I want to make sure that there is time for any questions on these resources. Um, if there are no questions, there are two other uh, resources I can share with you, but I also want to make sure that we have time for questions if we have them.
No questions right now. Just some thank yous and folks saying this is great information.
So while folks think about if there are additional questions, I do want to switch over. I mentioned that the CDC also has a rural health page. So, you know, overview information about some of the things that are higher uh, health issues in rural areas, some information about why, um, how it impacts people's lives. So again, this is some of the same information you'll see other places, but sort of framed differently, discussed differently, things like that. Along the side navigation, you have rural public health strategic plan, more demographic or health information, leading causes of death, uh, a toolkit. So if you are working, especially if you are a healthcare provider or working with healthcare providers, and then also the stories is another resource. Um, so in this case, the most recent one is about preventing swine flu in youth. And then with my last like 3 minutes, county health rankings, if you have taken classes with us in the past or have used this before, unfortunately, their funding is ending at the end of the year. They are still a resource for you until then, um, but to be aware that at that point, no new uh, reports are coming out, and at that point, they will be sunsetted. But until the end of the year, they are a resource for health data by location, um, understanding the data, and then so you can find data by location. And so, and I was picking on Bayfield County, Wisconsin. So the nice thing about this is that it will drop down and give you choices. So Bayfield County in Wisconsin is the only Bayfield. So does that. Um, and again, it gives you right up top, rural, not rural, low population density, and then gives you some comparative information. So here's Bayfield compared to the state average. It's about the state average, um, about the national average, just overall, and then some of the various health health indicators that you might be interested in. And it automatically populates the county, the state, and the United States, so you can look across. Um, and then also gives these indicators so you can see that they're actually doing better with primary care physicians. Doing better what? Anyway, sorry, so then you can also drop down and get more information about that. You can get it graphed. Um, so you can see uh, the trend lines. So the yellow, green, it's specifically the trend for the county you're looking at. It's not in relation to, in comparison, because as you can see, the ratio of primary care physicians in Bayfield County is much higher than in the rest of the state or the national average. But when you look at the graph, you can see that they are trending in a much better direction in terms of the ratio of providers per patient. Okay, I'm going to flip back to my slides. We did our demonstrations. I can stay on for a minute if there are any questions, but I want to make sure that folks are getting the evaluation. And again, you need to fill out the evaluation to get your continuing education credits. And even if you are not getting CDs, we love to hear from you. It helps us better our programming. And then finally, this is my contact information. So if there are any follow-up questions, please feel free to reach out. Any final thoughts or questions in the chat or the Q&A?
No questions, but I did want to remind folks, I put the link in the chat for the session survey. Just lots of thank yous. These are great resources, fabulous. So very, very positive.
Yeah. So like I
Okay.
said, feel free to reach out, especially if you are in that New England, New York area. We are the region for you. If you are not, I am happy to help connect you to your folks if you don't know them yet. There you go.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.